Hello everyone, I'm Gene Carlin, Chief Human Resources Officer at the Visiting Nurse Association of Ohio. I'm joined by Lisa Christosic here, the President and Chief Operating Officer at the VNA of Ohio. We're here to talk about VNA Gives, which is an opportunity for everyone to support our Patient Emergency Fund. Lisa, can you share with everyone why we have a Patient Emergency Fund?
Of course. Our Patient Emergency Fund is a one-time assistance program that's geared to financial help for patients that are under our services that may have a one-time need for this type of assistance. So historically, we have solicited donations from our staff, which many times we get 100% participation with our staff donating to the Patient Emergency Fund. These funds are used to pay gas bills, electric bills, purchase food, pay for medications, whatever that patient might need. The Patient Emergency Fund is there for them.
So how is this a little bit more unique than other emergency assistance programs? Is it more tailored to specific needs, and how does that happen?
I think the Patient Emergency Fund is specific to VNA of Ohio because it's really the clinicians that work with the patients in collaboration with them, identifying social needs, economic needs that may arise because of a hospitalization. So many times a hospitalization is an unexpected and unplanned event that happens in somebody's life. So having healthy food and good food in their refrigerator after they come home from an 8-week stay somewhere might not be the case. So we help identify that and then pay for those items that might be necessary in the short term.
Great. So this isn't a new program for us. What was it? Started 2011? Was that when we started this program?
Yes, as an organization, we identified a need because we service patients in many counties around the state of Ohio, but we noticed in certain populations there were significant financial challenges after a hospitalization or a healthcare issue with our patients. So arrived out of that was this Patient Emergency Fund, and it was created by VNA. It has been self-funded by VNA, and so we really are reaching out to a larger audience to help support our cause and help support our patients.
So how can people support today?
So people can support in a variety of ways today. They can certainly call 216-931-1490, or they can donate right on our Facebook page. If people are unable to donate today, Gene, they can always go to our website at www.vnaohio.org, and they can donate any donation. Nothing is too small. Our patients appreciate anything from $10 up to $1,000. They appreciate whatever we can give to help them at their time of need.
So 10, 35, 50, whatever a person is comfortable with, every little bit helps today. So again, it's 216-931-1490, or you can donate right on our external website at vnaohio.org. So I know when we first started, we raised $10,000 just through employee contributions. And today we've already reached a threshold of 4,000, and it's growing and growing every minute. So
I just got a new text. I think it's a little bit over 4,000.
Excellent.
So we are almost halfway to our goal. So I think we really should encourage people to please find it in your heart to help our patients that are in need. They really, with your support and our support, could help heal in their homes more quickly.
And if you want more examples of how we've impacted families that we serve, leading up to this VNA Gives Day, there have been videos posted on our Facebook page that gives you a good idea of how we've impacted persons' lives. Lisa, can you expand on some of those stories that you recall from your recent past where we've made a difference? Because many times these people need to focus on recovery and they're distracted by life. Can you give us some examples of where we've come in to help them?
Sure. We've had, unfortunately, home health patients that would come home from a hospital stay. Once they got back home, their apartment complex could have been infested with bed bugs. They would not have the financial resources to treat their home, buy a new mattress, and do all the things that are required to get rid of those pests. So we would kind of jump in with our Patient Emergency Fund to help them solve that problem so their concentration could be mostly on their healing and their well-being, as opposed to some of the things that might come up that are unexpected. So that's one example.
Because many times they do have limited resources.
Absolutely. We had another patient in our hospice department. They went through an unfortunate situation and had a fire in their home. So at that time, obviously the Patient Emergency Fund assisted that patient with numerous items from clothing to food to shelter. But also it was nice to see the VNA employees rally and raise over and above the funds that were available in the Patient Emergency Fund to help that patient and that family. So we are certainly a generous organization to care for our patients, and we're asking people to help us do the same and be as generous for our patients as we are, because our community really counts on us to help these folks to get them back to a healthy way of life.
So if you've just joined, my name is Gene Carlin, Chief Human Resources Officer here at the VNA of Ohio. I'm joined by Lisa Christozik, our President and Chief Operating Officer, and we're promoting our VNA Gives Day, and it's specifically designed to support our Patient Emergency Fund. And you can donate today. Lisa, what's the easy number they can call to donate right now?
The number is 216-931-1490.
Or right within this Facebook feed, you'll see a way to just simply reply and donate right now. People are donating $5, $10, $25, $30, hundreds of dollars. Whatever fits your pocketbook, whatever meets your desire to support such a worthy cause where we're helping patients and families every day to meet their needs in a time of crisis while we're helping them recover in their homes. Lisa, is there any other stories you can share that come to mind how the Patient Emergency Fund really impacted someone and turned things around for them?
Sure. So we have a program here. It's called a lymphedema program, and without getting too clinical, it's very large swelling of the lower limbs. So unfortunately, those patients need treatment on that, which requires certain socks and apparatuses that can get expensive and not always covered by insurance. So we did have a few of our social workers and therapists identify needs with a patient, and we were able to get that patient the wraps that they need. So prior to the Patient Emergency Fund getting involved, the patient couldn't get out of a chair. After we got money from the Patient Emergency Fund and the patient was treated with the specialized socks and wraps, the patient was up walking around. So these are concrete examples of how the Patient Emergency Fund can have an immediate impact on a patient's well-being and really help them to address their goals as they heal at home.
Great. So support us today. The Patient Emergency Fund really helps us fill in the gaps for families who have a need in a time of crisis. And you can simply donate by dialing 216-931-1490. Reply to the Facebook feed right now, or you can donate anytime to our organization on our external website at vnaohio.org. We welcome your donation and look forward to reaching our $10,000 goal today. And where are we at now, Lisa?
I think we might be almost at the halfway point. So
Excellent.
Please help us by the end of today get that other half in. But if you can't, please always visit www.vnaohio.org and click on Donate. And we would love if you could donate through our page.
We certainly welcome your support anytime. Just because VNA Gives closes out today doesn't mean that we do not welcome your support throughout the year. Thank you for your support. Again, any amount, $5, $10, $30, $100, we welcome any size donation to support this worthy cause.